everyone, and welcome to our Radiating Sciatica Pain is Painful Talk. So we're going to talk about sciatica pain and what we can do to help with that. It's based on an article by Health Realization. It's an article called Do You Have Sciatic Symptoms article. Dr. Justine has made herself available. There's lots of questions. Sciatica is really painful and there is some help. So we want to make sure that you can ask all the questions that you need. Feel free to give her a text. I wanted to welcome Dr. Justine with us here this evening. She is our leader here, and she believes that everyone deserves a healthcare team that focuses on prevention, optimal health, and open communication. Please welcome Dr. Justine.
Hello, everybody. We've got a great topic today for you on sciatica and how painful that can be, but how often you are able to get help. Coming up with amazing topics, though, about inflammation, and that affects sciatica. So learning about different foods, different exercises, different meditations to help reduce inflammation is coming up. We're going to talk about how to deal with carpal tunnel, tingling numbness, double crush, triple crush, thoracic outlet syndrome, also called TOS. That's when you get troubles in your neck that radiate and affect tingling, numbness, weakness in your hands. We got love languages and how to, share with others, the people you care about, and even the people you work with, how to be able to relate with them better, and how to strengthen your pelvic floor video. So great information coming up here to help you be your best. If you have any topics we haven't covered, share with us, and we'd be happy to do a wellness talk for you. And of course, we've done now over 200 different talks. We're trying to give back. These are free. Share them with friends and family. Our goal and our mission is to help as many families as possible, to help them be their very best and help be their innate, authentic self. So let's get into it about sciatica. Now, there's a lot of treatments for sciatica out there. This is when you have sharp shooting pain that comes down the back of your leg, the sciatic nerve. And a lot of times in the conventional ways, they give you a painkiller, a steroid, muscle relaxant, and that doesn't actually fix the problem, but it does help you not feel the problem. Problem is, it is a short-term relief, does have risks and side effects, and if we don't address a problem, it can lead to permanent damage. The more you leave any problem, whether it's a leak in your roof, a problem with your car, a problem with your foundation, it can get worse. So definitely with sciatica, I recommend that you get professional help. And this is something that numerous different professionals, from naturopaths, acupuncturists, chiropractors, massage therapists, osteopaths, physiotherapists, this is something we all work with. Difference is a chiropractor will take x-rays. The other professionals don't take x-rays, and it is crucial to see if you have any misalignments, congenital anomalies. Just last night at our practice, we found a young girl with a spatulated TVP, an extra joint. We've seen an extra bone formed in the lower back and how that can affect, or degenerative disc. So we're going to go over some areas that is super important. Also on x-rays, you can see cancer, you can see arthritis, you can see wear and tear. So I do recommend getting a checkup with a chiropractor, and then they often will refer you to physio, to massage, to acupuncture, to the other naturopath, the other therapies. Now, remember that chiropractors and medical doctors look at x-rays differently. Medical doctors do not look at alignment. They are great for cancers, fractures, arthritis, but they don't do treatment recommendations based on those, as far as how to improve that alignment, how to improve that disc space. So definitely there are different treatments, and the best ones are the ones that are going to be teaching you the skills to manage sciatica, how to prevent it in its tracks early, and things that you can do at home. So on our videos, we have already done a lower back stretching program, a low back strengthening program, a core and ab strengthening programs that help with sciatica. So what causes sciatica? It's not always known, but it does affect with the lower disc, that yellow area there's the shock absorber in the lower back. So it can be affected by the discs, the nerves in your lower back that leave from your lower back that go down your legs. And it can be affected by the piriformis muscle. That's a buttocks muscle, a gluteus muscle that goes from your sacrum out to your hip. And there are trigger points. These are tight areas in the buttocks. And you can get what's called piriformis syndrome, where that muscle is so tight that it can put compression on the sciatic nerve. And in a few cases, people will have the sciatic nerve go on top of that muscle or even through that muscle. And that will affect the sciatic nerve. One of the ways to help with the piriformis is to take a tennis ball, lacrosse ball, cork ball, and you can sit on the piriformis. I do teach that at the office, how to use 2 tennis balls in a sock. So you can even use it while driving to be able to pull it in and out easily and not have it go to your foot, affect your driving, to make it easier, because typically sciatica is definitely aggravated with driving and with sitting. Key point though is to get to the root cause of sciatica is to get a full thorough chiropractic examination to look at those discs, those nerves, the joints, the misalignments, the subluxations along the pelvis. And especially sometimes people only look at the numbness, the tingling, the pain coming down, the heat or hot and cold into the foot, but they don't look further up in the spine. And sometimes you can have subluxations even in the neck that are going to affect down to the lower back, or people that carry their head really far forward, that will also affect your lower back. So key is to have a thorough examination. If you're getting over 40, it does become more common to get different arthritic concerns, different sciatic concerns. Sometimes we get more sedentary as we get older. So it's key is getting moving. We may have a job where we've sat too much and it's like years and hours of sitting too much, which heavily affects sciatica in the lower back. We're doing more lifting, twisting, turning of groceries, the grass, the snow, luggage, especially lifting something with a twist out of the trunk, repetitive lifting of a purse, or putting the wallet in the same pocket all the time, all makes you more prone to signs of sciatica. If you have signs of diabetes, rheumatoid arthritis, psoriatic arthritis, that can make you more prone to arthritic concerns and sciatica as well. Some of the symptoms, we talked about the pain coming down, the numbness, tingling coming down the leg. It is typically one leg. If it is both legs, it is absolutely can be more serious. It can be a sign of stenosis. That's when the hole for the nerve in the spinal canal, it gets smaller, or the nerve that the hole that where the nerve exits, called the intervertebral foramen, it goes big, it gets smaller, and that can happen with different forms of arthritis. A severe disc injury can be very, very serious, and that can affect down the leg and take quite a bit of time, not 6 visits, but a month or more to be able to work with serious conditions of degenerative joint and disc disease. I know when I injured my neck and the discs in my neck, it was a good 6 months of hard work, adjustments, and therapy in order to be help the nerves that were going in the repetitive strain into my hands. Working with sciatica, it can have a variety of symptoms, but if it is down both legs, particularly between the legs, any challenge with loss of bladder control or increased diarrhea, bowel or bladder concerns with loss of control, that is a hospital visit. That can be a risk sign of cauda equina, affecting the lower part of your spine. So that is a severe sign if it is affecting bowel and bladder function. Sciatica can also affect strength, so you can feel like you're leaning to one side, you're limping, and so it can be very, very serious and debilitating and affecting our work and our ability to do things at home. Now, one of the things we do have to resist is just laying down, staying in bed. Sometimes we do need rest and ice, and meaning that we're not getting out, doing the groceries, we're not doing sports, we're not doing physical lifting or a lot of driving, which would absolutely make it worse. But rest can also be, it should be intermittent with walking and gentle movement. We have to resist the urge typically to touch our toes to stretch your hamstrings. That can make it worse as well, stretching that sciatic L5S1 nerve roots. So to make sure that if you're doing stretching, to keep the knee bent. And there are specific McKenzie exercises for lower back disc injury. So to look at those specific disc exercises, we can help teach you. They are on our website as well. So very important, start with icing, starting with an anti-inflammatory diet, anti-inflammatory proper nutrients. We have natural ones like curcumin, bromelain, devil's claw, that can be super helpful for those joints. Got to get gentle movement. Be very careful of heat. A lot of times people will put heat on. That does help the muscles if the muscles are in spasm, but if something is inflamed, it will help make that worse. So sometimes you can't tolerate ice, so put heat on your stomach while you have ice on your low back. And that will help normalize and create a better homeostasis for your body, make it easier to manage. Ice should be on somewhere or anywhere. If you're slim, 8 to 15 minutes. If you're larger, thicker muscle belly there in the back, then you might be going 10 to 15 minutes and then off. And you can switch it with heat, ice heat, or on-off icing at the beginning when something is inflamed. Definitely want to avoid straining. So that's with bowel movements or lifting, leaning forward and holding your breath. That's like a positive Valsalva. That aggravates your disc. So definitely keeping your shoulders back over your hips is most important for any type of lifting, or even having a bowel movement if you have a severe back pain. We want to make sure even in a sleeping position, not in a curled up position, that can aggravate things. So a pillow between the legs laying on your side and between the arms, or laying on your back with a couple of pillows under your knees bent. Definitely the worst position you can do with sciatica and with disc concerns in the lower back is to lean forward and twisting. So, hockey movements, baseball movements, golf movements, when you're dealing with sciatica, those are the movements we want to avoid short term. We do want to get people moving, but not with flexion and rotation of the trunk. That can aggravate the symptoms and make it worse. Be very, very careful of masking the pain with different types of medication. Short term, they can be great, and they can be a little bit, helpful just to get through the first 2 or 3 days. But careful, they do have side effects for the kidney and the liver, can lead to toxicity. And if we mask the pain, we might be doing things that our body's naturally telling us not to do. Pain is a way of stopping us and forcing us to slow down, to take care of the problem. And if we mask it, we may not be getting the proper treatment that we need, and we might be aggravating it unbeknownst to us. Be careful that some of these solutions are only short term. They mask the symptoms. They have side effects. So I definitely encourage you to get a spinal examination, get x-rays evaluated for areas of congenital anomalies, degenerative disc, confirm that there's no other forms of arthritis, cancers, tumors on those x-rays. Look for the cause of the problem, and then talk about potential solutions with chiropractors, osteopaths, physiotherapists, massage therapists, naturopaths, to find the right treatment for you. All of them can work together synergistically to help you get the best results. And I do encourage you to find a team that is willing to work together. So I know when I suffered with radiation down the leg, I did a form of chiropractic care, massage, and acupuncture, and it was super, super helpful for me. Behind me, I also have my inversion table. They can be super helpful. Careful, because it can make you dizzy or like a lot of blood supply to your head. So I don't tend to go completely upside down. I tend to go on an angle. That helps traction the joints. You just have to do a minute or so, and that can help your back. It can help your mid-back. It can even help your neck to help you overall. So chiropractic care, what we do is a thorough examination, x-rays, and what we do is corrective care. That means not just get rid of the pain, but look at the x-rays and try to show before and after x-rays so you can see the improvement. So for example, if you had braces, The before and after braces, your smile, your teeth should look different. If you change your diet and you did before and after with your blood pressure, you should see those numbers change. So we do different thermal examinations, and then posture, range of motion, x-rays to determine where you're at, and then monitor it every 12 visits or so. Adjustments can be done by hand, like you see in the picture here. We also use the table, or we could use different instruments to help you get the best results. Spinal decompression can be very helpful as well with disc concerns. That's when your body is tractioning and oscillating. In Brampton, Dr. Glatter does that. Dr. Brian Moore in more of the Toronto East End. So there are different specialists that can do decompression, and talk to your doctor about the options, but also the risks of decompression. Some of the other exercises: flexion distraction tables, flexion distraction exercises, physiotherapy, different physical exercises can be helpful. Interferential current, ultrasound, strengthening the weak muscles. For example, if you do have a sciatica, you might be leaning towards one side and need to strengthen the opposite side. You can see in the x-ray here, there's a huge loss of the lumbar lordosis. That's the curve, the C curve in the lower back. So getting a diagnosis: have you lost this curve, which will put more compression on those discs? And then how do you get that C curve back in your lower back? Should be aiming towards 45 degrees C curve in the low back. Some of the buttock stretches, glute stretches, super important. So yoga can be very, very helpful. But if you're doing anything like a downward dog with a straight leg hamstring stretch, that can also aggravate it. So be very, very careful that you discuss the exercises that are good for you and the ones that can hurt you, like a deadlift, for example, with your chiropractor, with your physiotherapist. And you can see here some of the buttock stretches, piriformis stretches, using that tennis ball under the buttocks or lacrosse ball to massage that, self-massage the piriformis using a foam roller. All of that can be helpful to help with sciatica. Chiropractors, what we specialize with the spine and the nervous system. So we look at the entire nervous system from the neck, toes to nose, from the neck all the way down to the sacrum, looking for spinal subluxations. Those are the misalignments in the spine. So that we're not just looking where the pain is, we're looking at the whole body and how it all works together. Knee bones connected to the hip bone, right? Well, lower back discs and joints, if there's areas of subluxation, can also be affected or have compensation patterns higher up. And those nerves from the lower back not only affect down your leg, but also affect the bladder, colon, sex organs as well, balance, strength into your legs. So we're here to help. We do offer complimentary meet and greet, so you can talk to the doctor about your concern before doing a thorough examination. And then talk about different, natural therapies to help you be better, not only feel better, but look at the root cause and how to prevent it from coming back in the future and maintaining your spinal health. So I hope that helped. We do have videos on specific exercises, stretches, and strengthening for your low back and core. Check those out. We have upcoming talks on inflammation, foods that will help you manage inflammation, help you manage numbness and tingling in the hands, and how to strengthen your pelvic floor. Stay tuned with us. We're here to help you. Connect with us. Share this with friends, because we look forward to a new you, an amazing start to 2023 to help you be your best. And of course, we would love to help you and your family. If you don't live nearby in Brampton, ask us for a referral, because the key is to help everybody be their best for themselves, their family, their community, to be able to give back. And you can only do that when you are your best. Take care, and I look forward to being with you soon.